People are starting to arrive.
Oh, that's his desktop.
No, you need to go to the desktop.
Oh, there we go, right there.
Thanks to those of you beginning to join, and we will start in a moment. Appreciate all you guys staying. I know it's late in several of the places there in Europe and Ireland. John, pass on to your friend Egan about his award, although we'll make sure he knows pretty soon. And here we go, Dr. Krishnan.
Yeah, I didn't send Tom's name here. I put AB. I didn't bother your name, but I give it.
So we did a share screen, but maybe it's a different share screen.
No, here it is.
This was the slide prepared in 15 minutes or something. Because there were some stock slide prepared and added. You would have seen this, so this is also good.
Right.
Just need to use the arrows to go.
This is the ones to go advanced, right?
Yep.
Good evening. Thanks, Mr. Tom Judd. Thanks for inviting me to present on behalf of the International Federation of Medical and Biological Engineering, friends, distinguished guests, the 4th International Conference on Clinical Engineering, Health Technology Management, conference organizers, plenary keynote speakers, faculty, student participants, industry sponsors, IFMBE colleagues, and representatives of our global biomedical engineering community. Okay, warm welcome to all of you from IFMBE. Over the last 20 months, the unwelcome pandemic COVID-19 has created major disruptions in most of our professional and personal lives. All of us, especially the global clinical engineering community members, have met the challenges caused by the pandemic with courage, determination, and prudent actions, and proceeded with our plans, projects, and real actions in mitigation of COVID-19 and efficient healthcare delivery. We start seeing the light at the end of the tunnel, and we can see this conference is a good sign for that. I have very pleasant memories of my previous visits to previous conferences in Sao Paulo and in Rome. I participated in several excellent lectures and meetings and met with clinical engineering leaders from different regions, representatives in the healthcare domain, nurses, administrators, engineers, policymakers, government leaders, professors, researchers, industry representatives, a big group of all the persons. I'm truly impressed with the dedication and commitment, the fantastic and tireless work by the clinical engineers at the international level. Thanks to Dr. Ayadin David, is he here? Yes. And Mr. I put ER, the engineer Tom. His D is higher than E, actually. E is higher than D. Engineer Tom Judd, and all the volunteers, everybody in this room, my friends who succeeded in this wonderful hybrid conference. My sincere compliments to the team of volunteers for excellent organization of this virtual conference. IFMBE is an international organization with over 70 national and transnational biomedical engineering societies, and we are really very happy to extend our support. We started as an international federation in 1959. So I give a quick overview of our federation. Our mission is to encourage, support, represent, and unify the worldwide medical and biological engineering community in order to promote health and quality of life through advancement of research, development, application, and management of technology. As you can see, ACCE is a transnational member. AAMI, is AAMI by any chance? It is.
Yeah, they are.
And we are at AAMI. So thanks to you for hosting this event right in this beautiful facility. We have Katma, Coral, there are members of Coral here, I think from Latin America. YAMBUS is the European Alliance, IEEE, EMBS. Then we have, several national biomedical engineering societies and several more. We have 4 regional groups: Asia Pacific, Europe, and Africa, Latin America, and North America. We are trying to make Africa as a region. And thanks to Tom and Yadin in giving us a helping hand and bringing in so many. In Rome, we met several African delegates. They have interest in becoming members of IFMBE. So we thank you. And I must highlight these 2 important divisions, so CED and HTAD, the Clinical Engineering Division. And Tom Judd is the present leader. He's been doing fantastic work. I think he has more than 24 hours a day. I don't know whether he gets extra hours from Amazon. We need to find out the link for that. And I must emphasize, Yadin actually came in at a time clinical engineering needed, I mentioned this morning, a big boost. And I think he has been giving a lot of boost. I think he needs to go and give boost in Texas as well, to a lot of boost that's needed there. But it is really essential. You need some real key people who are totally passionate towards clinical engineering and totally believe in that. So this is our governing body. I can see Yadin's picture there as well in the clinical engineering division. Okay. Interesting thing is IFMBE, along with our sister organization, IOMP, which is medical physics, is under the umbrella of IUPASM. And IUPASM, interestingly, is a part of the International Science Council, and it has several scientific unions, academies of science, and 135 affiliated academies. So it's really at a high level. Our liaisons are with the United Nations and WHO. We are also working with the standardization organization, and we will talk to the AME standards group tomorrow. Okay, we work closely with UNESCO, particularly on open science. We have link with WHO. I think it has been mentioned repeatedly. We take part in their global clinical engineering symposium, and we bring in a lot of participants. We try to have our own meetings there. So there will be at least 20 persons present to network as well as convey whatever is accomplished. Okay. Interesting to point out that we became a part of the WFEO, World Federation of Engineering Organization, which is covering all the engineers. So they did not have, interestingly, biomedical engineering. So we became their member, and we are also working through them with UNESCO on the Sustainable Development Goals. And you can see Sustainable Development Goal 3 is good health and well-being. This is by the United Nations. So I think all of us in this room, all of you who are listening to this presentation, we're all working towards 17 sustainable goals, and number 3 is of great importance to us. There's also quite a good liaison with the European Parliament on the special interest group. We have a journal, just mainly bringing us revenue for all of our activities. We encourage you to submit your papers, manuscripts for this journal. Okay. We are pleased to invite you to the World Congress 2022. It's going to be in Singapore, and there will be a presence, and there'll be several sessions which will be on clinical engineering, health technology assessment, and also covering areas of digital health and many current topics. Now I want to touch on something. For any conference to be successful, the most important factor is the participants. There can be excellent keynote speakers, plenary speakers, leaders like Tom Judd and Yadin David. However, you need participants. So that is very important. The planning was done extremely well. They are commendable. Tom and Yadin structured the participants in various groups. This also had the global summit, and I was very pleased to take part in several regional discussions. The support by Amy, Caleroy, Louise, Zoom, and others was incredible. The participations actually were superb, despite that time references. In some places it was midnight, some places early morning, some afternoon, some evening, but they were all enthusiastic in sharing their experiences. They gave their talk on sudden demands that happened due to the COVID crisis, how they tried to manage and how timely responses were required. Okay, the trends, the constraints, the challenges, and all the time to also comply with regulatory and other standards in terms of compliance requirements. Numerous problems were highlighted and some were common. So I did have a chance to talk with both Yadin as well as Tom. They kind of got input from various persons. And interestingly, they did the polling and got a very nice listing of various challenges. It was done in Rome, and some are listed from there. They're even carried forward. The capacity building, it's an important thing for clinical engineers, increased clinical engineering involvement totally in the healthcare domain. Lack of education and mentoring programs, lack of uniform body of knowledge, lack of professional recognition and credentialing standards. Okay. Increased role in decision making. This part I must say, I worked at Mass General Hospital, and I think we need to work together with the entire team. And if we have a good buy-in from hospital administration, we should invite them. I mean, their parents, their grandparents, they also become sick and they come to the hospital for treatment. They know what is the importance of pulse oximeter, ECG monitor, MRI machines, ultrasound devices. So once they understand, they appreciate the importance of devices in diagnosis, in treatment, in rehabilitation. This becomes really important. And in decision making, get the nursing people involved. There are some doctors who are really passionate, and the younger doctors, I think all of us are young, but the young ones are more tech savvy, and they are really interested in helping. In fact, some of them want to learn. They like to even suggest some good improvements to the devices, okay, which we can interact with the manufacturers. So in order to be successful in increased role in decision making, I think it is essential to collaborate and keep them informed, let them understand. Okay. There was also a lack of national association. This is a good forum to say that those who are not members, please join us. There are our website is there, www.ifmbe.org. Okay, so now I want to also not just throw these problems, I want to say some solutions. Education and training programs, they can help solve a lot of these. Not easy, and you need money for them as well. If you are going to send somebody for training, I don't know if any of you have done any budgeting for training. It is quite expensive. Of course, with COVID, there have been a lot of webinars and free sessions. And look at this conference. Tom and Yadin made it available to so many people, right? So that's fantastic. Clinical biomedical engineering associations and conferences like this. You get to learn about problems, solutions, and so on. So I come up with my own solution. Yadin may like this. I call it multi-helix model. So it has got hospitals. I put hospitals first because, things, we are all working with hospital, then industry, because, we have devices, industry. And I must bring up one point with industry, and I'm glad that Manish was here earlier. The software, the digital health, software plays so much. It is, in olden days, software was 10% or something. Now it is more than 50, 60%. So somebody from Medtronic gave $2 billion for software development. But the interesting thing is the software that you develop, that Tom, you mentioned about low income and low resource setting, that software can be translated to high income setting, like where Tom lives, in a country club or something, all this is possible. So software, and you can use today's software. So in software production, the development costs are high, but implementation is low, okay? Industry is very important. And so I think we should get industry involved. So during my presidency, I'm trying to get greater involvement from industry. Academia, of course, academics are everywhere, and it is very essential component, and government leadership. So I see some, mention of Ministry of Health and other agencies. I think that's really very important that we get them involved. And then with the Helix, I included also the societies. If you look at publications, they don't include the societies, but the societies are really like a glue to bring all of them together in conferences such as this. And there can be excellent networking, sharing of accomplishments, solutions, and opportunities. Believe me, the problems will keep on emerging. We have not conquered COVID-19. There will be more problems to come. And there will be more innovative approaches. And our friend Tom will be always talking about success stories. There will be many more success stories, and we can learn from them. We can try to contribute to them. I used like 3 C's before, that is cooperate, collaborate, and contribute, okay? So in terms of conclusion, we have been there since '59. We tried to unify the global biomedical engineering, clinical engineering community, the advancement of research, development, and application and management of technology. Okay, we appreciate the efforts by our global constituent membership. If you are not an affiliated member, please consider joining. Your continued participation and contributions are essential to achieve our mission. Congratulations to all the 4th ICEHTM conference participants. Stay safe, healthy, and happy. Okay, since our friend Yadin mentioned to Zoom, I think Yadin will appreciate this. At least it's not all the languages, but there's more than English only. We are truly international. So I sincerely wish that you have an enjoyable virtual conference and have productive discussions. We have one more day. There are excellent lectures. You can learn from a lot. And then you also can review these recording. I think they will make announcement when the recording is available. And then you will be asked questions to review them and answer in order to get special recognition. And just a few minutes ago, they awarded something. So please encourage people to take part. Just taking part is itself a win, not just winning a prize. You just take part in it. That is a great thing. So with that, I like to thank Tom, Yadin, and all of you in the room and all of you who are listening. Thank you very much.
Thank you, Dr. Krishnan. A great dad, a great partner, and a great collaborator. So we will end this part of the session. One more session to go with the keynote around credentialing with Dr. Jim Weir and us. And so we will end this program and start that in the next 5 minutes. And please join us. Thank you.